This anatomy is divided into two further branches called the plant's anatomy and animals anatomy. So because we are medical students, so we will discuss only the animals anatomy, and in animals anatomy we only discuss humans anatomy, right? What is actually anatomy is? Anatomy. It is coming from Greek. This word is coming from Greek, and this is the combination of two words, right? One is ana and the second is tommy. Ana mean up and it's mean cutting. So the whole word mean cutting up. Anatomy mean cutting up. The anatomy word mean cutting up. And different research says different things, but according to one research, the Andreas Vesalius is the father of anatomy. Andreas Vesalius. Because he wrote 7 books on anatomy, humans anatomy, and that's called Vesalius Fabrica. Vesalius Fabrica, right? And it is from 1514 to 1564, I think. 1514 to 1564, but he died in 1540, I think, and the further work is done by his students, right? This is 7 volumes books. This is book on human anatomy, right? And therefore this scientist is called the father of anatomy, father of modern anatomy, right? Now we can define anatomy is that this is the branch of medical sciences in which we study about the structures, right? Because I have already told you that if I know about the structure of this marker, I will easily explain the functions, right? If I don't know about the structure, I cannot explain the functions, right? Because the functions are mainly related to the structure. According to the structure, the things are functions, right? So anatomy is the structural study of living things, anatomy, right? Further, we divide this anatomy into two branches, the plant's anatomy and the animal's anatomy. This plant's anatomy, in which we study the structure of plants, right? In this we study the structure of animals, and another a small branch of anatomy is called the human anatomy, which is our field, humans anatomy. In humans anatomy, we will discuss the structure of human's body, right? So the branch of anatomy in which we study about the structure of humans is called humans anatomy. This is just the structural study of human body. That how what is the structure of heart, what is the structure of chest, what is the structure of brain, right? Now we will divide this humans anatomy into several branches, right? We will erase all this whiteboard and we'll take only this humans anatomy, and we'll try to divide this human anatomy in several branches. But this humans anatomy is just the structural study of humans body. This is so simple, right? Anyone can say how we can divide humans anatomy? What is the first branch of human anatomy? Gross anatomy. because we are not taking microscope abruptly, right? We will observe things, we will see, and we will study the structure by our eyes. So human's anatomy is further divided into two branches. Human's anatomy. This is the structural study of human's body, and we are dividing this human's anatomy into two branches, right? One is gross anatomy, and what is microscopic, or simply micro anatomy, right? This gross anatomy is also known as macro anatomy. It is also known as macro anatomy, and this is called, it is also known as histology. The second name for microanatomy is histology. But further, this gross anatomy is divided into two branches. The gross anatomy. I am telling you only the names. After the names, I will discuss one by one these branches, right? This gross anatomy is further divided into two. One is called cadaveric anatomy. Cadaveric anatomy. And what is called living anatomy. So, like this gross anatomy, this micro anatomy is also divided into two further branches. One is called cytology, and second one is called histology, right? Now we will discuss this gross anatomy. What is gross anatomy? When we are studying the structures of the body parts on our naked eyes, mean without the help of microscope, is called gross anatomy, or it is called macro anatomy, because macro is for large things and micro is for small things. So in micro anatomy we are using microscope. In the branch of anatomy, when we are using microscope, it's called microanatomy, and when we are studying without the help of microscope, it is called gross anatomy or macroanatomy, right? So for example, here we have gross anatomy. You all have to remember one thing forever for studying anatomy, that in anatomy we will always compare two things. We cannot study the structure of one thing. We will compare. If we are studying one organ, we will discuss the lower, upper, right and left sides of that organ, but we are comparing, right? For example, if I am studying eye, I will compare this eye with this eye, because the function of this, the functional parts of this eye is different from this, right? If I am studying the nose and I will compare these two, right? That eye is on upper side and nose is on lower side, right? So here gross anatomy, when we study the structure of structural study of human body with naked eyes, right? Mean that without the help of microscope, right? This is called gross anatomy. It is also known as macroanatomy. We are dividing this gross anatomy into two branches. The one is cadaveric. One is cadaveric anatomy. What is cadaver? Dead body, right? Because we are medical students and we cannot waste the lives of, we cannot play with the lives of humans. So first the medical students is studying on dead bodies, right? And they are learning inside the body that what is happening inside the body, what are the structure present inside the body, and dead bodies they are studying. So that is called cadaveric anatomy, when we study the structure of dead body. So this is the structural study of preserved dead body, preserve dead bodies. These dead bodies are present in anatomy labs of medical colleges, right? But nowadays we are studying mostly on models, right? We are studying on models because the scientists made the models like humans, right, from other things, so we can study that structures. But in cadaveric anatomy we study the preserved dead bodies, right? In medical colleges, right, the students are learning through preserved dead bodies, right? The next thing is living anatomy. Now this is very not, because we cannot cut living bodies directly. It is a very big risk for us, right? And also the life is a right to all the humans, right? This is the basic rights. So in living anatomy, when we try to study the living anatomy, we will use some methods. We will use some methods. We will use cameras, we will use x-rays, we will use MRIs, we will use ultrasound, right, to study the internal body. So this is the structural study of human body through different methods. These are we can cut the dead bodies directly, right, because they are not hurting, right? But we cannot cut the living bodies. So this is the structural study of living bodies through different methods. What are that methods? The first is observation. The first thing is our eyes, right? We will observe the things, right? For example, if someone got some cuts on the body, we will observe that cut, that what is the cut, what is the cause of this cut, right? For example, when someone is shorted by a bullet, we will observe that area, that what is the area shorted by this bullet, and what is the structural deformation occurs inside the body, right? So first of all, the methods using is the methods. Four things are very important to for you people, right? The one is observation. You will observe the eyes, you will observe the abdomen, you will observe the hands, face of patient, right? What is the difference, and you will compare that area with normal physiological body, a normal anatomical body, right? So this is the observation. For example, if someone saying that I am feeling some pain in my body, in my abdomen, you will observe the abdomen, either there is some swelling, there is some distensions, right? There are some scars or cuts, right? You will observe that on your eyes, right? After this you will palpate, and that thing is called palpitation. Palpitation. This is mostly the observation is studied through five senses and mostly by eyes, right? The next is palpitation. This is the study through fingers, right? If the same patient you observe with your eyes and there is no change in abdomen and still he or she is feeling the pain in abdomen, you will palpate the patient, right? That either there is some tenderness in the abdomen, right, or some hardness in the abdomen. So this is the finger study, the study through fingers. This is called palpitation, right? A study through fingers, and this is mostly through eyes. You will observe the things, you will see the things, right? The next thing is percussion. Next thing is percussion. This is the tackling study. This is also on, we study this by fingers, but we are tackling. For example, I am tackle this area, that what is the concentration of fluids here, what are the sounds produced by that fluids, right? And I will rotate the patient, or the patient will be in a lateral position, and I will compare this area with this, and this with this, superior with inferior, right with left, like that. And this is called the percussion, right? The next thing is auscultation. Auscultation is the study through stethoscope. Right? This is the study through stethoscope. And when this is stepwise process. First you will observe, then you will palpate, then you will percussion, and last you will study through stethoscope, and this is called auscultation. Right? These are the important things for this living study. After these four things, we will start the diagnosis, right? And diagnosis, the diagnostic study, which is also known as radiology, right? This is the next branch of the anatomy. This is the imaging study. It is also known as imaging anatomy. Imaging anatomy. By this we can take the pictures inside the body, right? For example, if I am going for X-ray, I am taking the pictures of bones, X-ray, right? MRI, magnetic resonance imaging, CT scan. And now for these things, for X-ray, for MRI, for ultrasound, for CT scan, the sections of body is very, very important, right? For example, if you are taking the CT scan from lower side, from this side, you must, it is required for you to know about the transverse sections, right? If you are taking the CT scan from right or left, or from lateral side, you must know the sagittal planes, the midlines, right? If you are taking the CT scan from anterior and posterior, or from sidewise, you must know the coronal planes, right? So for CT scan and MRI and X-rays, the sections of body are very important. The next thing is ultrasound. You must know ultrasound, right? And so on, etc. A lot of things. Endoscopy, colonoscopy, fluoroscopy. These are different types of endoscopy, right? So these are the methods by which we can study the living bodies. We cannot cut directly the living bodies, so we are using different methods, and this is called living anatomy, right? The next, this living anatomy and this gross anatomy, the cadaveric anatomy, mean gross anatomy, is further divided into two branches, cadaveric also and living also. And that branches are the regional anatomy and systemic or systematic anatomy, right? For normal physiology, systemic anatomy is very, very important, right? But for anatomy, for surgical procedure, for MRI, for CT scan, this regional anatomy is very, very important, right? And your course is in regional anatomy, right? Regional anatomy mean when we study the structure of living bodies or dead bodies in different regions. We are dividing the body into different regions, and then we are studying the regions separately. This is called regional anatomy. The regions of body are, when we are dividing the body into, for example, head region, thoracic region, for example, abdominal region, pelvic region, the upper limbs and lower limbs. These are the regions of body, and if we divide the body for study purposes into different regions, this is called regional anatomy. And if we divide the body in different systems, right, like for example digestive system, nervous system, reproductive system, cardiovascular system, respiratory system, etc., and try to study the body in different systems. This is called systemic anatomy. We can divide the body into regions and systems. In systems we must study the regions, and in regions we must study the systems, but in different ways, right? But if we compare the regional anatomy with systemic anatomy, the systemic anatomy is very easy. We study systemic anatomy in a very easy way, because we start one system from here. For example, if we are studying digestive system, we start from mouth, and by intestine we end at system, right? But in regions, if I want to study thoracic region or head region, if I want to study this head region, I must study the parts of cardiovascular system, the parts of digestive system, the parts of respiratory system, the parts of special senses, and also nervous system, and also the musculoskeletal system. So in regional anatomy we will study these all the things at once, right? And in systemic anatomy we study only one system which are passing from different regions, and in regional anatomy we study the different systems present in that region, right? So this is complex as compared to systemic anatomy, but we will study that. We will try to study this in a very easy way, right? So these are the regional anatomy and systemic anatomy are the branches of cadaveric and living anatomy, right? The next is this microanatomy, and in this we will use microscope, because we cannot see the cell and tissues with our naked eyes, right? So we will use microscope, and when we are using microscope in studies, that will called microanatomy, right? This is microanatomy. We will study the things through, for example, microanatomy. This is the structural study with the help of microscope. Structural study with the help of microscope, right? Two important branches are mentioned here: cytology and histology. Cytology is the scientific study of cell, and we have discussed this in detail in physiology. Cytology, right? In histology we will study tissues, because histo mean tissues and logos mean study, right? So the scientific study of tissues is called histology. And there are four main types of tissues present in our body, right? They are four main types of tissues. The one is epithelial tissues making the hollow organs, epithelial tissues, right? The next is muscular tissues making the muscles. The next is nervous tissues, and it is making the brain and spinal cord. And the last one is, which connects all these tissues with each other, is connective tissues. We will discuss these types in detail, right? But these are the basic branches of anatomy. The further branches, one is embryology. This is the first branch. 1, 2, 3, 4, 5, 6, 7. Right? And this one is 8. 9. 9 branches embryology. This is very interesting subject, embryology. Right? In embryology, we are studying the embryological development. Right? When we are studying the embryological development, right? For example, that how the ovum and egg is fertilized and how they form zygote, how the zygote forms the fetus, and how in fetus the heart, the brain, the stomach, the intestines, all the systems, how they are formed. Right? This is the embryological development, and in how many time they are formed, they are synthesized. Right? So this is the embryology. The next thing is surface. The 10th branch is surface anatomy. What is surface anatomy? All the structure which are near to skin. Surface anatomy, superficial anatomy, right? So all the structures which are structural study of that organs which are near to skin, right? They are called superficial anatomy or surface anatomy, right? The next is deep anatomy, right? So the structures of the structural study of all the organs which are away from skin, right? This is called deep anatomy. Structural study of that organs which are away from skin. For example, heart, brain, intestine, which are present deeply, right? They are called deep anatomy, right? And the next thing is the clinical anatomy. When you spend 4 years here or 5 years in medical colleges or in medical institutes, and after that you go to hospital and apply all the knowledge in hospital or in clinic for the diagnosis, treatment and prevention of diseases of patient, that is called clinical anatomy. So this is the application of anatomical knowledge. This is the application of anatomical knowledge you have learned in medical institutes, in hospitals and clinics for diagnosis, treatment and prevention of diseases is called clinical anatomy. And there are so many branches, other branches of anatomy are also present. For example, cardiology, urology, right? Neurology, osteology, myology, these all are the branches of anatomy, but these are the gross branches, the big branches, right? Any question? So, MRI sir.